Hi, my name is Krista. I'll be the nurse practitioner interviewing you today. To start out, can I just get your first name and your date of birth?
Jonathan, and 6/17/74.
Okay. All right. And are you here for a regular physical today?
Yes.
Okay. And then, as far as any issues going on right now, is there anything going on right now that's been bothering you?
I have a cold.
Okay. What symptoms are you having?
Sinus pressure, runny nose, sore throat.
Okay. Where exactly are you feeling the pressure right now?
In my upper forehead, like above my eyebrows, and in my upper nose.
Okay. And how long? And you've had a runny nose as well?
For about a week.
Throat. Okay. Sore throat. Okay, for about a week. All right. Are you having any pain right now?
No.
No pain now. Okay. Is the pain are your symptoms worse at any particular time of the day?
In the afternoon and evening.
Afternoon, evening. Okay. Have you been taking anything?
No.
For that? No. Okay. What color is the drainage?
It's green.
Okay. And have you noticed any drainage from your throat? Have you looked in the back of your throat?
I haven't looked.
Okay. All right. And the pain in the back of your throat, is it like a scratchy pain? Is it a sharp pain? Scratchy pain. Okay. Any fever?
No.
Any change in appetite?
No.
Okay. We will address some of that right here. So there's no fever. Do you have any history of allergies?
No.
No allergies. Okay. All right. So we're going to go through some of your past medical history and your surgical history, okay, as well. Overall, how would you rate your general health?
Excellent.
Okay. Do you have any surgical histories?
I had sinus surgery a year and a half ago. I had my tonsils removed.
What year was that? The sinus surgery? You had your
2015.
And what did they do during that sinus surgery?
Shave down the turbinoids and remove polyps from my sinuses.
Okay. And did you have any complications with that surgery?
No.
Okay. All right, and that was in 2015?
Yes.
Okay. Prior to that, what surgeries?
I had my tonsils removed when I was 12.
What year was that?
1988. No, 1986.
Okay. Are those the only two surgeries you've ever had?
Yes.
Okay. Have you had any hospitalizations?
No.
Okay. Were you hospitalized with those surgeries?
Yes.
Which surgery? Both?
The sinus surgery, I was there overnight. Tonsils were in and out in one day.
Okay, 2015. Okay. So as far as any other past medical history, have you had any other lung history, sinus histories, abdominal, appendectomy, anything like that?
No.
Okay. All right. And as far as your health maintenance practices, how you said your general health is excellent. What do you do to promote health? Do you exercise regularly?
Yes, I exercise 5 times a week, 30 minutes a day.
Okay. 30 minutes a day. Okay. How about diet? Do you drink sodas often?
No sodas. I take multivitamins, and I eat fruits and vegetables.
Okay. Any alcohol use?
Yes.
How often do you drink alcohol?
Once a week.
1 day a week?
One day per week.
1 day per week. Okay. Any history of, back to your medical history, any kind of blood problems, any history of arthritis, cancer?
No.
Mononucleosis at any time?
Nope.
Okay. How about your immunizations? Have you been current on your immunizations?
Yes.
Okay. Have you ever had a blood transfusion?
No.
All right. Good. Any history of back pain, knee pain, joint pain?
Lower back pain.
Okay. Have you been seen for that?
Yes.
Okay. Would you say it's chronic? Are you having back pain now?
Nope. I had it, and then with the proper exercise and stretching, it went away.
Okay. And what year were you having those problems?
2006 through 2013.
Okay. And it's resolved now? There's no back pain?
No back pain.
Okay. Any allergies to medications?
Penicillin.
Okay. How about any allergies to animals, foods?
Cats and dogs.
Okay.
No other
Cats
food
and dogs.
allergies.
Okay, no food allergies. All right. All right. And are you on any medications right now to include over the counter?
No.
You don't take any medications at all?
No.
Okay. As far as some social history, where were you born?
In Massachusetts.
Okay. Massachusetts, okay. And what kind of education have you had? What's the highest degree you've had?
Master's degree.
Okay. And what's your occupation?
Pilot.
Okay. Are you in the Air Force?
Yes.
All right. And do you smoke?
No.
No smoking. And you said alcohol just once a week usually?
Yes.
Okay. Are you sexually active?
Yes.
Are you married?
Yes.
As far as sexual preference, male, female, both?
Female.
One partner right now?
Yes.
Any drug use?
No.
Any drug use in the past?
No.
All right. As far as alcohol and all that, any issues with alcohol abuse or
No.
use? No. Okay. Family history. Do you have? So let's just go through a little bit with your mother. Does she have any medical problems? Any cancer, hypertension?
She has diverticulitis.
Okay. She's otherwise healthy, alive?
And then like an underactive thyroid.
Okay. Okay. And your father, is he living?
Yes.
Okay. Does he have any medical problems?
Yes. He has some medical problems. He has prostate cancer. And
How old was he when he was
has
diagnosed with the prostate cancer?
69.
Okay.
He has something else, low iron
Okay.
count in his blood, and what else? I think that's it.
Okay. Any drug or alcohol use with your parents?
Yeah. Mother drinks, father does not.
Any history?
Yes.
Okay. With which one?
Father drank. He had an alcohol problem.
And your mom alcoholic or no?
Nope.
Normal.
Just
Okay. What about on your mom's grandparent, or on your grandparents' side, on your mom's side? So your mom's mom. Any major medical problems there?
no major medical problems.
Is she living?
Dead.
Do you know why she died?
Old age. Congestive heart failure. She was 93.
93, time of death. Okay. And what about your mother's father, your grandfather on her side? Is he
died.
living?
No, he died.
Okay. How old was he when he died?
77.
And do you know why?
Heart attack.
Any other major medical problems that you know of on his side?
No.
All right. And so now to your father's side, your father's mother.
She died of cancer.
What age?
She was 80.
What kind of cancer, do you know?
Breast cancer.
Any other major medical problems for her?
She she had colon cancer as well.
Okay. Do you know which did she have first? Do you know?
Colon cancer
Okay.
in the 80s, the 1980s, and then breast cancer came about in the later years.
Okay. Any other major medical problems for her that you're aware of?
No.
Okay. What about your father's father?
He's dead.
What age did he die? Do you know?
75.
Any major medical problems that you're aware of?
No.
Unknown, or you don't know?
Unknown.
And then a little bit more about your social history. Do you live in a house?
Yes.
Okay. Do you have children?
Yes.
How many kids do you have?
3 children.
All right. And as far as funding for home, car, food, are all those within normal?
Yes.
Good. Okay. So we're going to go through just a few. One more thing as far as your family history. Any psychiatric mental illness that you know of with your parents or grandparents?
No.
Okay. How about yourself? Have you been diagnosed with anything?
No.
Okay. Any history of anxiety, depression with yourself?
No.
Okay. All right. So no history of Parkinson's disease or
No.
arthritis, anything
Nope.
common like that. Okay. All right. So I'm going to go through a few questions about a head to toe. Any issues that you're having? Any issues with rashes, dry hair? Any issues with your skin, nails?
No.
All right. How about any lymph nodes? Have you noticed any swelling? Your neck, on your armpits,
No.
in your hip joints here?
No.
Okay. All right. And with the cold, have you noticed any lymph node swelling?
No.
How about joints? I know you mentioned back pain before. So are there any sore joints? Any inflammation that you've noticed?
No.
All right. And as far as any bruising, have you had? I know you said your father had a history of low iron. Do you have any history of anemia, or have you noticed any bruising?
No.
Okay. Any prolonged bleeding that you've noticed?
No.
Any problems with headaches or?
Nope.
Okay. Any seizure activity ever?
No.
Any memory loss? Okay. As far as your eyes go, have you noticed any blurred vision, any change in vision at all?
Yeah, near vision is and low light. I have just a little bit of trouble. I either need better eyes or longer arms.
Okay, so up close has been bothering you. How long has that been bothering you?
About 6 months.
Have you been seen for that yet?
No.
Okay. Any pain or change in your hearing?
No.
Your ears. Hearing is normal.
Yes.
How about your nose? How after the surgery? How has that been?
Excellent.
Okay. And with this cold, are you feeling congested now?
Yes.
Okay, so you've had a runny nose with congestion. Okay, and you said that was green discharge that you've noticed?
Yes.
Okay. How about your mouth? Any jaw pain when you open and close
No.
your mouth? Okay. Have you noticed any change in your teeth, in your gums, extra bleeding?
Nope.
Any ulcers in your mouth?
No.
All right, and your throat. I know you said you had a sore throat. So you said scratchy?
Yes.
Okay. And you didn't notice, you haven't looked in the back to see if there's redness or swelling or anything like that?
No.
All right, and you've had a tonsillectomy?
Yes.
Okay. All right. Your neck, have you noticed any swelling in your neck, any difficulty in your range of motion?
Nope.
And you said you haven't noticed any lymph nodes?
Correct.
chest, breast tissue area, I know breast cancer is mainly affects women, but have you noticed any abnormal lumps, bumps anywhere on your chest?
Nope.
Okay. And as far as overall fatigue, how's your energy level been?
Good.
Okay. Have you had any night sweats?
No.
So normal energy, no night sweats. Any increase in urination or thirst?
No.
Have you had a cough with this cold?
No.
Okay. Any shortness of breath recently?
No.
When you exercise, has it been normal? Have you had any increase in shortness of breath?
No.
Okay. No cough there. So you haven't noticed anything lung-wise as far as shortness of breath, wheezing, cough, anything like that?
No.
Okay. Have you been, to your knowledge, been exposed to TB?
Lived in Korea.
Okay. Have you had a TB test since that was done?
No.
Okay. And when did you move back from Asia?
2015.
Okay, 2015. Okay. And you've never been tested for
Correct.
TB? Okay. But you're not having any night sweats, any nausea, decreased appetite?
That's right.
Anything like that. Okay. How about your heart? Have you had any heart palpitations, chest pain?
Yes. I have a heart arrhythmia.
Okay. You have a heart arrhythmia. Do you know what it is?
Something like bigeminy. It's irregular below 80 beats per minute.
Okay. Okay. Below 80. Have you been evaluated by a cardio?
Yes.
When did you first get diagnosed with this arrhythmia?
2009.
What symptoms are you having now?
It's noticeable when you take my pulse, but other than that, I don't really have any symptoms.
Are you noticing any heart palpitations?
At the moment, no. It comes and goes.
Okay. Are you taking any medications for that?
No.
Okay. And does it affect your exercise or your daily life?
No.
Okay. And okay. And has anything changed since you were seen in 2009 for this?
No.
Lay there. Okay. And no chest pain?
No.
Okay. Do you notice any swelling in your feet?
No.
No. Okay. And do you ever notice any bluing of around your mouth or your fingers, anything like that? Like your
Nope.
No? Okay. Okay. All right. As far as your appetite goes, you've had a normal appetite?
Yes.
Okay. How about your stools? Any constipation, diarrhea?
No issues.
Okay. And do you usually have bowel movement daily?
Yes.
Any abdominal pain that you've noticed?
No.
Okay. Any change in your bowels at all?
Nope.
Any pain in the rectal area? Any hemorrhoids or
No.
any issues there? Any rectal bleeding that you've noticed?
No.
Any hernia in your inguinal in the joints here? Have you noticed any lumps or bumps in
No.
that area? All right. Any urinary symptoms at all?
No.
Okay, so you're going to the bathroom a normal amount of time in the day? You don't
Yes.
notice that you're going more frequently? Okay. Do you do testicular exams?
Yes.
Okay. How often do you do that?
Monthly.
Okay. And you notice any changes at all?
No.
So you notice any lumps or bumps there? Okay. Have you ever had a history of an STD?
No.
Okay. How about kidney stones?
No.
Just do that. Okay. Good. No lower back pain, anything like that?
The lower back pain was ultimately a result of, I think, some muscle strain and maybe bulging disc.
Okay. But nothing with your kidneys? You've not had
Nothing
any
with the kidneys,
histories?
so
No,
yeah.
Okay. Any discharge that you've noticed?
No.
All right. Good. Okay. Any arthritic pain or numbness around
No.
your body that you've noticed? Okay. Any history of gout?
No.
or joint pain. Good. Okay. How about any change in your nervous system as far as the ability to smell?
No issues.
Okay. Any problems with balancing?
No.
Tasting, speech?
No.
Swallowing?
No.
Oh, that's been normal. Okay. Any dizziness at all?
No.
Okay. Have you noticed any weakness in your workouts or
No.
anything like that? Okay. Any history of seizures?
No.
Okay. Have you noticed any feelings of feeling uncoordinated or?
Nope.
Okay. All right. And you're not having any pain right now?
No.
Okay. No pain. Good. Okay. And as far as just your mental state now, you said no anxiety or depression right now?
Nope.
Okay. How are your general relationships going within your family?
Good.
How about your work life?
Good.
Okay. Any increase in stress recently?
Yes.
Okay. In home life or work life or personal life? Or?
Work life.
Okay. And how do you normally deal with that?
Work harder.
Okay. How are you feeling that? Are you feeling any effects of the stress as far as anxiety, depression, physical symptoms, fatigue?
Probably fatigue, and that was a big thing. Fatigue.
Okay. Are you feeling a generalized fatigue? Are you saying specifically work, or are you feeling a generalized?
Yeah, fatigue from work.
Okay. But your overall energy, you feel like is normal?
I have normal energy level. It's just all used up.
And work. All right. So there's no relationship issues between friends, family, or specifically at work?
No.
Anything like that? Okay. How about your sleep patterns?
Good. 7 hours on average
7 hours
per night.
Okay. Good. Okay. So thank you for your time here. We're going to go ahead and move on to the physical exam, and I'll leave the room, let you get changed, and I'll be back for that. Okay.
Okay.